Italy is hoping to make COVID vaccines available to children aged under 5 next year, the country's health minister has revealed. Andrea Costa said on Thursday that he is hopeful jabs can be made available to the very youngest by the end of March. We await the work of the scientists, who every day give us the right weapons to fight the pandemic, with great trust, he said. Most countries are now vaccinating at least some children against COVID, with a handful already inoculating those aged under 5. That is despite the fact that severe illness in under 5s is extremely rare, and deaths in that age group are almost unheard of. In England throughout the whole of 2020 there was just one death in a child aged under 5, and just 25 in children under 17 between March 2020 and February 2021. Around half of the 25 who died had severe underlying conditions and required intensive medical care such as breathing or feeding tubes. But it is hoped that immunizing children will help to stop the spread of COVID to older and more vulnerable age groups, especially among school-age children. Vaccines are not as effective at stopping infection as they are at preventing serious disease and death from COVID, but they do still provide some protection against transmission, including against the Omicron variant. Nations which do not routinely vaccinate children are also finding it hard to get their overall jab rates above 70%. The theoretical level required for herd immunity. For example, the UK vaccinated its adult population at a faster rate than most other European countries, with its campaign largely finished by early summer. But its overall jab rate then stopped around 68%, slightly above the European average but just short of the herd immunity threshold. Britain has since been overhauled by the likes of Spain and Portugal, which have vaccinated 80% and 90% of their population respectively, largely because they have been offering the jabs to children. The UK only offers a single dose to children aged 12 to 15, and has only recently started offering 2 doses to those in that age group with underlying conditions. Spain and Portugal have been fully vaccinating all children aged over 12 for months, and began offering 2 doses to those aged over 5 earlier in December. As a result, both countries have fared better against the winter wave of COVID than the UK has. Cases are now climbing in both due to the emergence of the vaccine-busting Omicron variant, but neither has introduced widespread restrictions while hospital admissions and deaths remain very low. China was among the first countries to offer jabs to the under 5s, having approved its Sinovac vaccine for those aged 3+ back in June. Several countries which rely on the Sinovac shot for their jab campaigns have followed suit, including the likes of Hong Kong, Argentina, and Bahrain. Most European nations now vaccinate or have plans to vaccinate children aged above 5 after the EU's medical regulator approved the move last month. The United States also gave approval for Pfizer's vaccine to be used in children aged 5 and above back in November. Some states have started mandating vaccines for children aged above 12. A much smaller group of nations restrict the jabs to only older children, including the likes of Brazil, Russia, India, Sweden, Norway, and Mexico. Cuba is the country which has offered vaccines to the youngest kids, making shots available to everyone aged 2 and above. Advertisement.